Hello, in this video we are going to talk about cavernous sinus. Each cavernous sinus lies on the lateral side of the body of the sphenoid bone and located on either side of the pituitary fossa. Anteriorly, the sinus receives the inferior ophthalmic vein and the central vein of the retina. The sinus drains posteriorly into the transverse sinus to the superior petrosal sinus. Intercavernous sinuses also connect the two cavernous sinuses to the sella turcica. It's important for you to remember the structure which is associated with the cavernous sinus because they repeatedly ask in the MCQs for FCPS Part 1. The internal carotid artery and the sixth cranial nerve travels through it. So sixth cranial nerve is the most susceptible nerve that is susceptible to injury, or if there is an MCQ that asks the structure passing to the cavernous sinus is the abducens nerve, that is the sixth cranial nerve, and the other structure is the internal carotid artery. However, in the lateral wall, the third and the fourth cranial nerve and the ophthalmic and the maxillary division of the fifth cranial nerve is present. The hypophysis cerebri lie medially in the sella turcica. The veins of the face that are connected with the cavernous sinus via the facial vein and the inferior ophthalmic vein are important route for the spread of infection from the face. Another important thing related to cavernous sinus is the cavernous sinus syndrome. A patient may present with periorbital edema, ophthalmoplegia. Sixth nerve damage typically occur before third and fourth nerve damage. Trigeminal nerve involvement may lead to hyperesthesia of the upper face and eye pain, and there could be central retinal vein thrombosis. So, in a patient present with variable ophthalmoplegia, there is decreased corneal sensation, Horner syndrome, or occasional decreased maxillary sensation. And cavernous sinus syndrome can be secondary to pituitary tumors or the other neoplasm that can produce a mass effect. It could be due to carotid cavernous fistulas or cavernous sinus thrombosis related to infections. It need to be differentiated from the lateral sinus thrombosis, which leads to the repulses of the sixth and the seventh cranial nerve. This was about the cavernous sinus syndrome. We are going to discuss the roughy point related to the cavernous sinus in the next video. Thank you for listening.